Good morning. I don't know if you can hear behind me. It's a very passionate crowd. We're hearing lots of chanting, lots of singing, shouting. We've seen people with drums, with noisemakers, and lots of cars around here honking in support of these strikers. And you can see they've kind of taken over this plaza area of the Kaiser Permanente facility here on Sunset Boulevard. They're also on the other side of the street, kind of marching around and making their presence known. This is the largest healthcare workers strike in U.S. history. People on these picket lines say they're frustrated by staff shortages that have left them feeling overworked and burnt out. They also want higher pay and some job protections. Now, this affects support staff. This is people like emergency department technicians, medical assistants, receptionists, housekeepers. This does not include doctors and most nurses. Now, the big question here is, how is this going to affect Kaiser patients? Officials say they have a plan in place to keep hospitals and emergency rooms running through the strike, but some non-urgent appointments and procedures might have to be rescheduled. Workers say they're doing this for their patients, who they believe deserve better. Listen here.
The short staffing crisis, it started in the pandemic and we've never really recovered. So us as frontline healthcare workers are on the line listening to the patients, and the Kaiser executives are not listening to the patients. We have in our facility at least people that are doing the jobs of 2 to 3 people, and the patients can feel it. They're frustrated, and we're frustrated too.
Now, Kaiser's responding to some of those claims that she just mentioned, saying rising inflation has led to healthcare experiencing a massive surge in expenses driven by drugs and supplies, equipment shortages, staffing costs, and supply chain disruptions. At the same time, in the wake of the pandemic, demand for care has increased dramatically as people come in for care that has been delayed. They just added that Kaiser is not immune to any of those pressures, just like anybody else. Now, they say they are at the bargaining table and they are continuing to try to hammer out a deal. They say they have agreed on a few points, but certainly not all of them. The deal has not been reached yet, hence the strike. This is supposed to last for 3 days, ending on Saturday at 6 a.m. This is certainly a very large strike. 75,000 healthcare workers across the country are involved in this. It's a story we'll continue to follow. That's it for now. I'll send it back to you.
All right.